If you're dealing with chronic low back pain, trying to decide between different treatments can be, well, it can be a real headache. So in this explainer, we're going to cut right through all that noise and give you a clear action plan to finally break that cycle of pain.
You know, this quote just hits the nail on the head, doesn't it? The real frustration isn't just the pain itself. It's the whole routine. It's planning your life around doctor's appointments, recovery days, and just hoping that this time, the relief will last a little bit longer.
And that is the big question, right? That's what we're here to answer. It's about getting off that hamster wheel of just chasing pain relief and moving toward a real strategy, one that puts you back in control of your treatment, your schedule, and your life. Okay, so first things first, let's talk about what the real problem is here. It's not just the ache in your back. It's that feeling of being completely trapped on a treadmill of procedures, where every few months, you land right back where you started. So this is where we need to shift our thinking. The real win isn't just getting your pain scored down to 0 for a couple of weeks. No, the real victory is breaking free from that whole cycle, the procedures, the recovery time, and all the expensive guesswork that comes with it. And that brings us to the most important idea in this whole explainer. The choice between RFA and steroid injections, it's not actually about the procedures themselves. It's about proving, with cold hard data, where your pain is really coming from in the first place. And to do that, we need a better way to measure if something is working. So forget just asking, hey, how long did the relief last? Instead, I want you to imagine you're watching 3 different clocks, because each one tells a really important part of the story. This is how we're going to redefine success. The pain clock. Okay, that's the obvious one. But the function clock, now that's where life really happens. Can you actually sit through a movie? Can you sleep through the whole night? That's real, meaningful progress. And then there's the calendar clock, which measures the burden on your time. True success is when all 3 of these clocks are moving in the right direction. Let me tell you a quick story about why this is so critical. Let's talk about Maya. She gets a facet injection, and on day 1, she feels incredible, absolutely amazing. So amazing, in fact, that she declares, "I'm fixed," and spends the entire day doing all the chores she's been putting off for months. But fast forward just 2 weeks. That initial fantastic relief, it's gone. And she's right back where she started, feeling totally frustrated and honestly pretty confused. And this is where it all falls apart. At her follow-up appointment, the entire conversation is just based on these vague feelings. Well, it kind of worked for a bit, and then it just didn't. There was no data. We don't know if the relief was just from the numbing medicine or if her function actually improved. And without those answers, the next step is just a total shot in the dark. All right, so now that we know just how critical it is to have good data, let's really dig into the 2 procedures at the heart of this whole decision. Okay, first up is radiofrequency ablation, or RFA. The easiest way to think about this is like turning down the volume on a faulty speaker that's just blasting static. The procedure uses very targeted heat to basically quiet down the specific little nerves that are sending pain signals from your joints. Now, it's not fixing the arthritis itself, but it can shut down that pain signal for a good long while. Then, on the other hand, you have facet steroid injections. And it is absolutely crucial to understand that these things have 3 totally different jobs. Yeah, they can calm down a flare-up, but maybe even more importantly, they work as a diagnostic clue to help confirm where the pain is coming from. And number 3, they can be a bridge to rehab, giving you a window of less pain so you can actually do the work to build strength. Okay, so now let's put them side by side, head to head, because really understanding the best time to use each one, that's the key to making a smart choice. So here's the bottom line. RFA is your go-to when you've already confirmed the pain source and your goal is long-term relief from that pain signal. A steroid injection, that's a better tool for either getting a nasty flare-up under control or, more strategically, for buying yourself that precious time to get into physical therapy. Let's break this down by what really matters to you. Duration? RFA often gives a relief for 6, 12, sometimes even more months. That means way fewer visits to the doctor. Steroid injections are a lot more unpredictable and can lead to frequent trips. And you have to know about the common disappointments. With RFA, people sometimes mistake the initial soreness for the procedure failing. With injections, the big trap is chasing smaller and smaller amounts of relief without any kind of long-term plan. Think of that relief you get from a steroid injection as a window of opportunity. It's incredibly valuable, but you have to remember, that window will close. The whole point of buying yourself this time is to use it.
This is your chance to really work on your mobility, build up your strength, and have a plan for what's next.
Now, compare that to the RFA window. It's usually much, much longer. That gives you a huge opportunity to build up your body's strength and resilience. The big goal here is that even when those little nerves eventually grow back, your body is so much stronger that it doesn't automatically mean you're back in debilitating pain.
Okay, so we've defined the problem, we get the options, we've compared them. Now for the best part. Let's wrap all of this up into a concrete action plan that you can start using today.
It all boils down to a super simple 2-step plan to take back control. Step 1, for the next 7 days, start a function diary. Don't just track your pain score on a scale of 1 to 10. Track your pain plus 3 specific daily activities that actually matter to you, like sitting or sleeping. Step 2, go into your next appointment prepared with 3 key questions.
All right, screenshot this if you need to. These are the 3 questions that will completely change the conversation with your doctor. Number 1, is my pain facet dominant or is it mixed? This forces a real diagnostic talk. Number 2, what's our stop rule if this relief fades fast? This keeps you from getting stuck on that injection treadmill. And number 3, if this doesn't last, what is plan B? This shows you're thinking strategically for the long haul.
And really, that's what this all comes down to, isn't it? When you use this framework, you're not just a patient getting a procedure anymore. You're an active partner in your own care. The next time you walk into that doctor's office, you won't just be buying another procedure. You'll be buying clarity. And that right there is how you finally break the cycle.